When people think about heart disease, they often imagine dramatic symptoms like chest pain or breathlessness. But one of the most dangerous threats to heart health is something far quieter and far more common, sitting right on the kitchen shelf, hidden inside colorful packets, ready-to-eat meals, and convenient snacks. And that threat is ultra-processed food, a category of foods that has slowly become a daily habit for millions of seniors without them realizing the damage it causes. Ultra-processed foods are not simply cooked or prepared foods. They are industrial formulations loaded with refined flour, excess salt, added sugars, unhealthy fats, preservatives, artificial flavors, and chemicals designed to increase shelf life and taste rather than nourish the body. And while these foods may look harmless or even attractive, especially because they save time and effort, they quietly create inflammation inside the body, raise blood pressure, disturb cholesterol levels, increase blood sugar spikes, and strain the heart day after day, which is particularly dangerous for seniors whose metabolism is slower, whose arteries may already be stiff or narrowed, and whose heart may already be recovering from years of wear and tear or even surgery. Imagine starting the day with packaged breakfast cereal, white bread toast, or sweet biscuits, then snacking on namkeen, chips, or cookies, followed by a frozen ready meal or processed meat sandwich for lunch, and later sipping sugary tea or soft drinks. Individually, these items seem small, but together they form a continuous stream of salt, sugar, and unhealthy fats that forces the heart to work harder every single hour, raising blood pressure and fluid retention, increasing bad LDL cholesterol, lowering protective HDL cholesterol, and gradually causing fatty deposits to build up inside arteries, narrowing blood flow and setting the stage for heart attacks, strokes, and heart failure. For seniors, the danger is even greater because aging naturally reduces muscle mass and metabolic efficiency, meaning the body cannot process excess sugar and fat effectively. So these harmful substances remain in circulation longer, damaging blood vessels and creating chronic inflammation. And inflammation is one of the biggest hidden drivers of heart disease because it weakens artery walls, encourages plaque formation, and increases the risk of clotting, which can suddenly block blood flow to the heart or brain. Another major issue with ultra-processed foods is sodium overload. Since many packaged foods contain extremely high levels of salt to enhance flavor and preservation, and excess sodium causes the body to retain water, leading to swelling, breathlessness, and elevated blood pressure, which forces the heart to pump against greater resistance, like pushing water uphill, making the heart muscle thicker and weaker over time. And for someone who has had bypass surgery or valve surgery, this added stress can slow recovery and increase the chance of complications. Sugar is equally harmful because repeated spikes in blood glucose lead to insulin resistance and diabetes significantly multiplies the risk of heart disease by damaging small blood vessels and nerves that control the heart, which is why many cardiac patients also struggle with blood sugar control. Beyond the major nutrients, ultra-processed foods often lack fiber, vitamins, minerals, and antioxidants, which means even though a person may feel full, the body is actually undernourished, and without fiber, cholesterol cannot be removed effectively. Without antioxidants, inflammation cannot be controlled, and without adequate protein muscles, including the heart muscle, cannot repair properly, leading to fatigue, weakness, and slower healing after illness or surgery. Many seniors also unknowingly rely on these foods because of convenience, living alone, or reduced cooking ability, but the cost of convenience becomes hospital visits, medication dependency, and declining quality of life. The good news is that the heart begins to improve remarkably quickly once these foods are reduced and replaced with real, natural, minimally processed foods, because whole foods like fresh vegetables, fruits, whole grains, lentils, beans, nuts, seeds, fish, and healthy oils provide the exact nutrients the heart needs to heal: fiber to remove cholesterol, potassium to balance blood pressure, omega-3 fats to reduce inflammation, protein to repair tissue, and antioxidants to protect blood vessels. And even small daily swaps can make a big difference, such as replacing packaged snacks with fruits or nuts, switching from white bread to whole grains, choosing home-cooked meals instead of ready meals, drinking water instead of sugary beverages, using herbs and spices instead of excess salt, and reading labels carefully to avoid long ingredient lists filled with unfamiliar chemicals. It is also important to plan meals ahead, keep healthy foods easily accessible, and involve family members in meal preparation so that healthy eating becomes simple rather than stressful, because long-term consistency is what truly protects the heart. Seniors recovering from heart procedures should especially focus on soft, nutritious meals rich in protein and fiber while limiting processed meats, fried foods, instant soups, bakery products, and sugary desserts, and they should monitor weight, swelling, and blood pressure regularly to see the positive impact of dietary changes. Over weeks and months, many people notice lower cholesterol, better energy levels, improved digestion, reduced medication needs, and stronger stamina simply by removing ultra-processed foods, proving that food can either harm or heal depending on daily choices. And understanding this hidden danger empowers every senior and caregiver to take control of heart health naturally. The heart works tirelessly every second of life, and it deserves real nourishment rather than artificial substitutes. So by choosing fresh, simple, homemade foods and minimizing packaged and processed items, seniors can protect their arteries, strengthen their heart muscle, improve recovery after surgery, and enjoy more active, independent years ahead. Because ultimately the path to a healthier heart is not complicated or expensive. It begins with one conscious decision at every meal to choose real food over ultra-processed food, and that single daily habit can add years of life and life to those years.